let's talk wisdom teeth, Dr. Crail. First of all, is a person really wiser who has a wisdom teeth and a little more stupid if he never has one? Anyway, tell us about wisdom teeth. What is it all about? Why do we have teeth which apparently always need to be taken out? And what is it all about this impacted wisdom teeth and all these horror stories around wisdom teeth?
Okay, well, firstly, wisdom teeth has no known correlation to your intelligence, so we can put that to rest. Okay, but wisdom teeth, some people get them, some people don't. Some people get extra wisdom teeth. It varies from person to person. Wisdom teeth get a bad reputation because oftentimes they do cause trouble. Now, there's many people going around with wisdom teeth that are straight, that are fine, that cause no trouble. That's fine. But they can cause trouble because oftentimes they come in, there's not quite room for them. They get blocked on the way in because they come in a little later in life. And so they can cause problems with gum infections and decay, swelling and pain. And so oftentimes the person wants that out.
I see. So when does a person know that and how should he find out and make sure to take care of that his wisdom tooth are need to be taken out or need not to be taken out and stuff like that?
Well, most wisdom teeth come in between the age of about 16 to 25 years old. Occasionally sooner or later, but they come in, and if the person is aware of them coming in, if it's just a minor irritation, it's probably not a big deal, although they should be having regular dental checkups because sometimes there's silent problems. Sometimes there's things that the person may not be aware of. They may not feel a pain, but there could be problems occurring. So we look at the wisdom teeth certainly as part of our regular dental exams. If there is any problem, we'll certainly discuss it with the person to see if it needs treatment. We want to get it treated and take care of the problem before it becomes a bigger one.
Okay, all right. So is it, some people, wait. Is it possible that because as older as you get, I heard as more difficult it is, the post trauma of the operation? Is that true?
To some extent, yes, that is true. If you need to have them out, it's better to have them out when you're a little younger. The body is a little quicker to bounce back and to heal itself. Although it can be done, of course, when you're older. It just may be another couple of days of discomfort, but it'll heal.
Okay. Well, I guess dentistry overall, the injections, the way you give the injections, the way you numb the mouth even before you give the injection so that you really don't feel the needle, and overall medicine to make people feel comfortable after an operation to kind of, so to say, ease the pain of the, the surgery pressure has become so much better that probably the horror stories about a wisdom tooth as well as root canals and other things are really, it's not anymore what it was. Do you find that to be true?
Generally speaking, yes. Things do get better over time. The stories that go around are usually the stories about the worst experience. The ones that the people had a good experience, those don't get as much press.
Yeah, well, isn't that the same with life and everything, Yes. All right. Again, good. So it's not a really super big deal. Just, again, regular dental visits, probably the dentists will see what's going on, monitor it, and then say, look, it's time to take him out over the next half a year to a year. Let's schedule that type of stuff.
That's correct.
All right. Thank you very much.
Thank you.